Hi, this is Joe. It's April 12th, 2021, and I'm making a short video featuring the Nurse's Pocket Guide by Marilyn Dunges, Mary Frances Morehouse, and Alice C. Murr. Now, the copy that I have is the 14th edition, but we do have the 15th edition out there. The people I'm making this video for are the members of my class. You were shown how to use this book, but then that was a while ago, and then we have to actually go over how we use it, because in a recent meeting with the students I realized people weren't necessarily doing the pertinent parts and they were making it harder to do than they think. I'm going to start off by giving you a tip here. You are required to buy the Nurse's Pocket Guide for this program, and essentially if you don't have it, you're going to have a lot of difficulty doing care plans throughout the program. You have to, if you buy the 15th edition, it's about $50. It's not part of the regular package. If you actually are clever, you can go to Amazon and find a way to buy the 14th edition for about $5 and shipping and save yourself some money. Now, I'm usually in favor of the most recent up-to-date textbook, but then I have to tell you, the Nurse's Pocket Guide doesn't change that much from edition to edition, and it's unlikely to. So now there's a few features here to go over. First, most of the contents is essentially a dictionary of nursing diagnoses. And on the inside we have these 2 pages that say what they are, but one of the things that comes with it is when you get it, you get this little laminated card. And you should bring the book to clinical, but that doesn't mean you have to carry it around in your pocket, because it does weigh a couple of pounds. But if you separate this card out, this card is, a laminated card. You could spill coffee on this and it would be okay. And this gives you the list of all nursing diagnoses. And what it does is it gives them according to Gordon's functional health patterns here. So under each heading, it gives you the one. Everything related to activity is there. Then they're alphabetized, but it kind of provides an extra level of order to it. And what you can do is, our care plan form that we use has very similar headings to these to go through. So this kind of gives you a comprehensive list. I guess there's a couple hundred of these, and that's kind of what it does. So that's the first tip, is bring the book with you, or have the book when you're doing care plan, but you don't have to carry it around as you're carrying this. Now, the next thing is this. In the back of the book, there's what I call the blue index. And see, when I'm doing this, it has these letters, and I'll go back again. It has these letters in, blue. See the S in blue, etc. And that if I look at it, if I kind of go like this with the book, and then I look at it this way, I can see the line of the blue letters going through there. The blue index is incredibly handy. Now I'll show you why, and it will save you some time in hunting things and in engaging your imagination. We all know that there's a difference between the medical diagnosis and the nursing diagnosis. We are doing nursing, we are providing nursing care, therefore we are using nursing diagnosis. However, if you do know the medical diagnosis, what you can do is the blue index gives you a list of medical diagnoses, and under each medical diagnosis, it gives you a list of the possible or likely nursing diagnoses. And for example, general surgery. Under general surgery, it says deficient knowledge, anxiety, risk for positioning injury, risk for injury, risk for infection, imbalanced body temperature, breathing patterns, deficient fluid volume. What's on the next page? and that's it. So here's what you do. You get the barest outline of what's wrong with the patient. Then you say, okay, general surgery. You look that up and you say, okay, if they're going to have nursing diagnoses, there's 1, 2, 3, 4, 5, 6, 7, 8 of them. Here's the 8 that might go with general surgery. And it gives you some advanced hints as to how to ask your questions or what assessments to make. So this actually tells you a quick summary of the nursing diagnoses and some of the etiology statements that might go with it. Now in that one it actually says also refer to post-op recovery period. So if I go to post-op recovery period, I see that it says on a general basis you can expect to make sure you listen to their lungs. If I do this, check their temperature, check their mental status, check their fluid volume, ask about pain, look at their skin and the wound, and risk of infection. So that actually tells you, based on the medical diagnoses, what might be wrong. Now the difference is, just because it's on this list as a nursing diagnosis associated with the medical diagnosis does not mean it's truly there, but it does mean you would be wise to check. So those are two examples. But then if I just check one randomly, and you can like play this yourself. Myocardial infarction would be pain, impaired mobility, and wait a minute, where are we? In pain, anxiety, and risk for decreased cardiac output, and risk for a sedentary lifestyle. So if we had a person with a heart attack, we'd go assess them for those things and see if they have them. So then the next thing, and I'll just pick one more, I don't want to flay this to death. In the 14th edition, this all starts around page dun, 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 dun. This all starts around chapter 3, health conditions and client concerns with associate nursing diagnosis. So as it says, it's got 450 medical diagnoses across the board, and it gives you the problem statement for each, and it helps you do assessment. And that's critically important to be able to do that, and it has code words that go with it too. So that's what it does, and then it basically starts with abdominal hysterectomy, abortion, abruptio placenta, abscess, etc. You name it, it's got it in here for a medical problem, and you can use that as clues as to what to assess. Now the next thing is this. And the key way of looking at this from the student's viewpoint is, when you choose the actual nursing diagnoses, you have to have the defining characteristics. Like for example, I go to page, where is this? Page 784 in the 14th edition, and I say impaired skin integrity. Where is that from the previous page? Okay, 783, it says impaired skin integrity. It says related factors. And then what happens is, the key thing for you to look up for care plan things is the defining characteristics. And it says subjective and objective. Now this sounds crazy. It's so obvious when you say it out loud that when I say it out loud, you'll laugh. But if you choose impaired skin integrity, see where it says under objective, alteration in skin integrity, foreign matter piercing skin, invasion of body structures, etc. What happens is, if you choose that nursing diagnosis and you decide that's the one I'm going to make interventions out, when I'm reading the care plan, I go back to your report of your head-to-toe assessment, and I look in the skin section for example. And if in the skin section it says, this guy has a wound 8 inches long on his abdomen and it looks like this, blah, 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 redness, edema, erythema, etc., then you have shown that the person does actually have an alteration in skin integrity. Now, even something simple as an IV is an alteration in skin integrity, because if you think about it, they have to make a hole in the skin in which the IV goes through. So, like, if you're saying alteration in skin integrity, one of the things is you have to give the inventory of every possible hole in the skin there is on the person's body. If you pick it and then I go back and look under the skin section in the database and you've left that blank, that means you don't have the information to prove that that diagnosis is apropos to that person. So when you go in there and you check, you make darn sure that if there's any alteration whatsoever, it gets documented in the first few pages of that chart where you're going through the functional health patterns. Now the next thing here is under nursing priorities, it will give you a long list of all possible things, and my latest warpath has been making sure that the interventions you choose are active ones. You don't only want to assess, evaluate, measure, this, that, the other thing. You want to actually do stuff that maintains integrity. So they'll give you 3 or 4 nursing priorities. Don't only pick your interventions out of the first one. Make sure you've read all. This one has 4 possible nursing priorities. Make sure you've read them all. Actually 5. Make sure you've read them all so that you pick some from each category and all that stuff. So that's that. Now if I pick another one, where would be a good one? I'm just picking him randomly. All right, here's the psychosocial one. Situational low self-esteem. Very important. It gives you a quick thing, definition of how you get low self-esteem, all that kind of stuff. But then it says the defining characteristics: helplessness, purposelessness, can't deal with anything. Says self-negating verbalizations like, I'm no good, I'll never master this. Indecisive or non-assertive behavior. So in that case, if you're going to pick that nursing diagnosis, I'm going to look for a quote in which the person said, I'll never learn how to do all this diabetes stuff. It's too complicated. I might as well just roll over and die now. Which is like, there's lots of things rolled into that. But among other things, that person's helpless and they can't do it. And it's like, they figure they're no good at anything. And so you can say, well, we have to do something that allows the person to have a success, for example. Now, one of my favorites is, if you haven't read this, every nursing student should read this one, which there is one in the coping section called Defensive Coping. And in this one, it's on page 196. And this is the time of year when all the students start having this one. All right, so defensive coping. Repeated projection of falsely positive and self-evaluation based on a self-protective pattern that defends against underlying perceived threats to positive self-regard. What does that mean? And what it means is the person is the rated factors are fear of failure, unrealistic self-expectations, and then it says denial of obvious problems, weakness, projection of blame, responsibility, hypersensitivity to discourtesy, grandiosity, rationalization of failures, superior attitude towards others, ridicule of others, and then it says hostile laughter, and difficulty establishing or maintaining relationships. Now there's one, if you haven't actually thought about it, think about it. If we got rid of all the defensive coping in the world, where would we be? I would argue in a better place. But so now, here's the thing. If the person says, oh, there's nothing wrong with me, you're picking on me, and you're the one who's the problem in this situation, not me. Now, how often have you heard a patient say that? A lot of times what happens is, if a patient's not dealing well with things in the hospital, they actually start doing stuff out of this nursing diagnoses, and they're like, yeah, I know my liver's fried, but I needed a drink at the time, and I don't regret it. It's like, okay, now that's rationalizing a poor choice you made in the past life, that kind of stuff. So they all have this. Now, this has already gone on for 15 minutes. I'm going to keep it short. Summary is, it's okay if you get the cheap version that's a little older. Next one is, you don't have to carry the whole book around in your pocket, but do find this thing and carry that around. Third one is, use the blue index in the back to give you hints. Fourth one is, make sure that your database has the defining characteristics in it. Now I'm going to sign off, and I'd love to hear from you guys. Catch you later. Bye.